5 women share what it's like being pregnant during the coronavirus crisis. We asked pregnant women to share their hopes and fears related to COVID-19, and what it feels like to be giving birth during the coronavirus pandemic. Coronavirus pandemic. Pregnancy in the age of coronavirus COVID-19 is causing major concern around the globe, including in Canada, where there are over 17,000 cases, according to Johns Hopkins University. The thought of labor and delivery can be stressful enough during pregnancy, particularly if it's your first child. But in this age of coronavirus, however, expectant mothers have an added layer of uncertainty and concern, including how the virus might affect the health of the fetus to potentially having to give birth alone. Unfortunately, not much is yet conclusively known about how coronavirus affects pregnancy. The flu, on the other hand, is known to be particularly risky for the health of pregnant women and fetuses, which is why flu shots are recommended before or during pregnancy. For coronavirus, the effects are still unknown in the first trimester, regarding birth defects, but there hasn't been a large increase seen in miscarriages, though data is sparse, says Felice Gersh, MD, OB/GYN, founder, director of the Integrative Medical Group of Irvine, in California and author of PCOS SO's Fertility Fast Track. Later in the pregnancy, there may be heightened risks for preterm delivery, growth restriction, placental abruptions, and more C-sections. Luckily, there does not seem to be a substantial increase in the risk of stillbirth. No infants born to mothers with COVID-19 have tested positive for the COVID-19 virus, according to the Centers for Disease Control and Prevention, CDC. In these cases, which are a small number, the virus was not found in samples of amniotic fluid or breast milk. Still, mothers-to-be are heading into hospitals just as they're forecasted to be critically short-staffed and under-equipped. Hospitals around the country are implementing changes in response to the COVID-19 pandemic, says Diana Spalding, certified nurse midwife, pediatric nurse, and author of forthcoming The Motherly Guide to Becoming Mama. The most profound is likely the change to support teams, but other possible changes might be more extensive, questioning upon admission to assess individual risk, and people wearing masks and personal protective equipment, PPE. Many hospitals are now only allowing one support person in the room, with no postpartum visitors, and some women are delivering wearing masks or having unplanned C-sections, with their birth plans out the window. Paying attention to the mental health of new mothers is essential. New moms are vulnerable as it is, but this pandemic makes them even more so, says Spalding. This feels like such an isolating experience to go through, but new mothers need to know they are so deeply held, and not alone. We spoke with 10 expectant mothers about their anxieties surrounding their impending births. Here, women share in their own words. So much is changing every day. This is a nightmare and I can't imagine a worse time to be pregnant, confesses Lauren Wellbank, a mother of 2 who is 39 weeks pregnant. Everything is so unprecedented, and things are changing every day. I feel like I can't catch my breath. I feel like I'm in a suspended state of horror because every time I turn around something else crazy is happening. Wellbank shares that she just got word that her hospital will take temperatures every 6 hours for the duration of her stay at the hospital. If they become elevated at any time, they may separate us from the baby. I'm actually less worried about catching the virus than I am about something happening because the hospital is short-staffed or because their new policies and procedures are reactionary instead of being well thought out, she says. I heard a story last night about a new mom in North Jersey having her baby taken away from her because she experienced an unexpected uterine rupture and they were afraid that was a sign that she had COVID-19. I simply cannot imagine someone taking my newborn from me during such a crucial time. While Wellbank previously had a birth plan, she's given it up. My birth plan has sprouted wings and flown out the nearest window. Absolutely nothing looks the way it did 2 months ago when I filled it out. The only thing that is still the same is that I'd like to avoid an epidural. At this point, that has more to do with not wanting extra people in the delivery room with me and less to do with my original concerns that stem from a prior bad experience. Still, she's finding silver linings. I'm still very hopeful that things won't be as bad as I'm afraid they will be. Childbirth, no matter how many times you've done it, is unpredictable. Even without a pandemic, there would be things for me to stress about. I'm way less worried about how much pain I'll be in and more worried about everything else that is happening. Wellbank is also grateful for her OB/GYN. I would be remiss if I didn't mention how great my OB and her staff have been. I was having a panic attack in the exam room today while I was waiting for her to come in and talk to me about an induction. They are currently asking all their patients to schedule an induction as soon as is reasonable to avoid having people delivered during our estimated peak. I was literally in tears by the time she walked in, and by the time we finished the exam I felt a million times hoping their partner can be there during delivery. There's a lot going through my mind experiencing all of this, says 30 weeks pregnant Lisa Coleman, mother to a 3-year-old girl. We struggled for 3 years to get pregnant with our daughter and ended up doing IVF. I always said if we can get through that, we could get through anything. Being pregnant and giving birth was nothing compared to struggling to get pregnant and the IVF process. This pandemic is really testing that statement. As her baby's birth approaches and cases continue to spread, Coleman has realized the pandemic will affect her delivery. At first, I think I assumed that the pandemic would be over by the time I needed to start preparing for our second child. That this was not going to be something that even affected this pregnancy at all. Things we took for granted with our daughter, like being able to run to the store or ordering whatever we needed online and having it be available, are proving to be very different this time. Just today I looked at diapers on Amazon and the delivery date was in May. She's trying to keep her anxieties at bay, but it's difficult. I keep saying to myself, you still have 10 weeks. I went to my OB appointment today and everyone was wearing masks and the reality of the situation hit me like a ton of bricks. I knew in my head the doctor would be wearing a mask, but experiencing the appointment like that really affected me. I got into my car and cried. I thought about how that could be how it is when I got to the hospital when I give birth. Everyone in masks, maybe even me. Not allowed to leave my room. It's scary. The biggest fear, however, is that her partner might not be allowed into the room. This is my biggest anxiety about giving birth, not having my husband with me. He was my advocate during the birth of my daughter. I had some complications after giving birth that I needed him there for, so that idea of him not being there is terrifying. Despite it all, Coleman is trying to keep a sense of humor about it. My husband keeps reminding me that I'm pretty lucky to be spending my 3rd trimester working from home wearing comfortable clothes. I'm saving money on maternity clothes, that's for sure. I'm also trying to enjoy the massive increase in family time while it's just the 3 of us, my husband, daughter, and me. I have more time to prepare for our baby's arrival, not commuting to the office daily. So all of that are some silver linings. In looking forward to a source of joy in dark times, I did not choose or plan to be pregnant during a once-in-a-century global pandemic, says 36 weeks pregnant Natalie Kennedy, mother of 1 child. I feel that the health crisis has added yet another layer of uncertainty to pregnancy. This makes me more anxious than I otherwise would be, having one more, very big, thing to worry about. While Kennedy is not as worried about labor itself, having been through it previously with her son, she is nervous her husband won't be allowed into the delivery room, and childcare plans are up in the air. This is my main worry. As of right now, partners are allowed in the delivery room, but not allowed in other parts of the hospital. However, because of the current rules in place at the national level, we don't have childcare for our 2-year-old, so there is a good chance my husband will have to stay home with him, even if partners are allowed. I expected that my husband would be with me, and I assumed that I would be able to request an epidural if I wanted. Both of those things are now up in the air because of hospital rules on visitors, partners, as well as the canceling of non-essential appointments, which I would need to be pre-approved for the epidural. Because her hospital is small and specializes in maternity and non-infectious diseases, Kennedy is not worried about coronavirus patients being there. I am more concerned that despite our best efforts, my newborn may be exposed at some point. There is so little known about how the virus impacts children this young. If anything provides comfort, it's the future. The baby is a great source of hope herself. While we are anxious about the future that awaits her, we cannot wait to meet her. We feel continuously worn down by the bad news and the tragedies that other families are grappling with, but we hope that this new life can be a source of joy for being extra vigilant about social distancing. Being pregnant has made the pandemic a lot scarier, says Whitney Sandoval, 36 weeks pregnant with her second pregnancy and third child. Although so far, most of the information coming out about women who are pregnant and babies being born is positive, there isn't clear information on the ramifications of catching COVID-19 while pregnant. About 1 month away from delivery, Sandoval assumed she'd be anxious for her baby to be born about now, but instead she's trying to keep him in. I'm kindly asking him to stay put all 4 weeks, she says. Catching the virus is a fear, for a variety of reasons. I'm worried about what it would mean if I caught it in terms of my family and the birth experience. I have 2 toddlers and can't imagine having to isolate from them for 2 weeks. If I caught the virus, I would have to birth without my partner. I haven't allowed myself to look at what happens after delivery if the mother is positive for COVID-19 when she delivers. Would I still get to see my baby? Would I have to be quarantined from him too? My biggest anxiety is that I'll contract COVID-19 within a 2-week window of my delivery. If you're worried about infecting your family, here's how you can stop the spread of coronavirus at home. Sandoval is grateful her city of Wichita is still allowing one partner to attend hospital births, although she's hoping for a home birth. This week, I sat down and made a series of birth plans to be mentally prepared if I get COVID-19. If someone in my family gets COVID-19, if we get transferred to a hospital, and if my husband can't be in the delivery room. Both Sandoval and her husband have been strictly social distancing for more than 2 weeks and plan to keep it up. We're hopeful neither of us nor our children will get COVID-19 and we won't have to worry about who in our family can and cannot be there. I am hopeful nothing too crazy will change in the next 4 weeks. My pregnancy anxiety has been pretty high, and the pandemic is only increasing it. But, I have been trying really hard to focus.